Season in Congress, and Medicaid funding isn't just a priority for Idaho legislators. This past session, they put restrictions on who is eligible for Medicaid expansion in Idaho, something sponsors of the bill said would save the state millions of dollars. Governor Little signed that into law, by the way. Now Congress is positioned to make billions or even trillions of dollars in cuts. Much like they did in our state house, Idaho stakeholders made their case today on Capitol Hill about the impact major Medicaid cuts will have on the gem state. Joe Paris listened in to find out why there's such a push to cut Medicaid spending now.
Yeah, it's something that kind of goes in with the policies and the conservative overarching, I guess, ideas in Congress. The idea that cutting Medicaid would save the United States a lot of money and would be more efficient in terms of spending and outcomes if it was a smaller program. That's the conservative approach to this. This is also part of the metagame of just cutting spending across government. Social Security and Medicare are sort of off limits, so Medicaid is the big target. If Republicans are successful, critics like the Idaho Asset Building Network and Idaho Supports Medicaid, they worry about the outcomes.
Medicaid expansion would likely end. The Idaho legislature is statutorily required to review the program and decide whether to terminate expansion if federal funding drops below that 90%. This would push approximately 88,000 Idahoans back into the health coverage gap without any affordable health insurance options.
So if Medicaid expansion does end and people do end up in the gap, critics ask what safety net programs will be there to help them. Legislative action in recent years has changed what that looks like in a big way. And Hillary Hagan, who you just heard from, she's with Idaho Supports Medicaid. She explains what she sees happening.
The catastrophic healthcare fund, the state indigent county fund, those were programs that were available that are no longer available. So if we see cuts of this magnitude happen and Medicaid expansion goes away, Idahoans who are now finding themselves newly uninsured are not going to have any safety net program other than the emergency room.
The new Idaho law on Medicaid also says if the federal contribution for Medicaid goes down and lawmakers are not in session, the Department of Health and Welfare here in Idaho, they need to take action. And that includes making reductions or elimination of what are called optional benefits. That's also a concern, Brian, for advocates of Medicaid. They understand that people want to save money, but not at the cost of human life, they say.
I understand this is a process that's going to take a little bit of time, though, this Medicaid consideration in Congress.
Yes, this won't happen overnight, and there are a lot of rules and administrative procedures to get through. However, Congress right now weighing if it could be billions or trillions in cuts. The House and Senate kind of working that deal over in D.C.
And stop me if I'm wrong, Idaho's changes to their our Medicaid expansion still has to be approved by a federal agency. Has that happened yet, or what do we know about that?
Correct. So those are the waivers that need to get signed off on, and as of today, that has not happened.
Okay.
You may remember back in 2019, during the previous Trump administration, Idaho had applied for some waivers. Those sat on a desk and were actually never addressed. So we expect these to be addressed in more, I guess, timely manner, but we will find out.
All right. Thank you very much, Joe.